To answer that question, I actually want to take a 10,000 foot view first, thinking about cancer screening. So, when we think about cancer, I fundamentally think about cells that are growing faster than they should. And all of our body, every single cell that we have, has DNA inside of it that controls when that cell grows and when it stops. So you can think about this simply like when there's a child, the DNA inside of a child is telling everything to grow. But at some point, your body realizes you don't keep growing. So your nose doesn't continue to grow until the day that you die, for example. You reach your adult size and you stop. That concept of when a cell should grow and divide and when it should stop is one of the most fundamental things that are encoded in our DNA because it's essential to life itself, the ability for cells to grow and divide. What we've learned in cancer research over the last couple of decades is that when things go wrong with those signals telling a cell when to grow or when to stop growing, that's when a cancer can develop. So cancers happen because those signals get messed up and all of a sudden a cell is capable of growing without stopping. There are no signals that tell it to stop. We've learned again what a lot about specific genes that are abnormal in the DNA that allow that uncontrolled growth to happen. We also have realized that there are patterns that we see in families of people who are genetically related to each other, where we see either the same cancer popping up over and over again in different individuals, or a small subset of cancers that are happening to family members. And that led us to make the connection between those genes we see in the cancer cells leading to growth and those same genes being present in the whole body of the family members who are developing those cancers. So this has led us to realize that we can identify some people who have what we call a genetic predisposition to develop certain cancers, meaning a change in the DNA that's present in their whole body that makes them more likely to develop cancers in certain parts of their body. Breast cancer is the most commonly, I think, well known in the general population, where we think about the BRCA1 and 2 genes. When a person has a mutation in either one of those genes in their body, they are more likely to develop breast cancer. They're also more likely to develop other types of cancers, cancer like gynecological cancers, prostate cancers, pancreatic cancers. And so recognizing those patterns and identifying people who are at increased risk of developing those cancers is sort of step one. The reason that it's important to identify people who are at increased risk is when we know that there's increased risk, there's often something that we can do to mitigate that risk. And that is where we want to be, right? We want to be preventing cancers if at all possible. And if we're not preventing them, we want to be catching them early. And what I mean by that is identifying cancers when they are very small and before they've had a chance to invade into deeper tissues and spread throughout the body. The reason that that's an advantage is because typically cancers that are identified at a low stage can be cured, number one, and can be cured with relatively less invasive and less toxic treatments. So universal cancer screening is the concept of looking at a person's genes to see if they have any one of a number of different changes within their DNA that makes them more likely to develop a whole host of different cancers. I would say there's two big issues. One is patients aren't necessarily aware that they qualify for testing. So again, as the science here has changed rapidly, I don't think that the general population is able to keep up with it. And I also think medical professionals struggle to keep up with it. So there are two main categories of more targeted genetic testing for cancer predispositions. Ones I already mentioned are breast cancer predisposition genes. The other are colon cancer predisposition genes. So in families where there's a strong family history of colon cancer, people may or may not be getting screened for those colon cancer genes. When there's a strong family history of breast cancer, they may be getting screened for breast cancer genes. What a lot of people don't realize is typically if you qualify for either one of those, breast cancer or colon cancer screening, you can typically qualify for the whole panel, something that will look at all of the cancer genes. And I generally think more information is more power. So if you're going to screen someone for cancer predisposition genes because of a family or personal history of cancer, we might as well just be comprehensive. The first time we do it, get all of the information that is available to us and be able to give the best advice moving forward for that person and any family members who may also be affected. I think the second piece is physicians aren't always aware that when people qualify for kind of one of those, either breast or colon cancer screening, they typically would qualify for a panel that will do all of it. So doctors have gotten much better, especially doctors who see a lot of breast cancer or see a lot of colon cancer. It is very much in their wheelhouse to test for the genetic predispositions to their lane, for example, the colon cancer or the breast cancer, without realizing that they could order a test that will do both in sort of one shot and give complete information. I think this is step one. So the more that we can educate everybody about the changing science and what's available on the clinical market is the most important thing that we can do. I encourage every patient, every time that they go for sort of their annual checkup to their doctor, to ask if anything's changed about cancer screening. The recommendations are rapidly evolving for lots of different cancer types. When we should get mammograms, when we should get colonoscopies, when we should get pap smears, how all of that has evolved. And I would encourage people to ask specifically, are there genetic tests that we should be getting as well? That's not part of, as patients, our general vocabulary, and I would like it to be more common, that people know that that's out there and that it's a specific question that they're asking of their providers. I think the biggest thing is knowledge is power. The more that we know about our risk for developing serious illnesses, the more that we can do to mitigate that risk. So understanding your family history and asking questions of your providers about whether or not there's more that you can do to learn about your own risk is number one. And then number two, some people have a lot of anxiety about getting these test results. There is a concern, there's a fear. If you know you're at increased risk of getting something, some people feel like they're just sort of waiting for that to happen. Again, this is where knowledge is power. The more we know about your risk, the more that we can screen appropriately and do everything that we can to either remove that risk or reduce it to the point where we can find any problem's going to happen right when it shows up and treat it effectively and quickly.